Welcome. I'm Cynthia Burghard, as you just heard, and I'm here to talk to you about two of the things that are really important to me. One is about data and the critical role I think it plays in healthcare. And if we're going to get out of the challenge of cost and quality, we're really going to need to use data to help us figure that out. And secondly, around health equity. I think the COVID-19 pandemic has really put front and center an issue that's been bubbling up for quite some time, but frankly is really one that we can no longer ignore. So we're going to talk about a couple of things. One is about how health equity from a payer and provider perspective, and even public health perspective, needs to move from charity to equity. And then secondarily, about the role that geospatial data plays in creating a more equitable healthcare system. So let's talk about health equity first. What is it? It's about the equitable distribution of resources, making sure that there's healthy food available to every person. Empowered people. I think people who are financially disadvantaged and socially disadvantaged are downtrodden, and they need to feel that they actually have a role to play in their own healthcare. Healthy community conditions. I mean, we only have to watch the maps of the last year to watch air pollution really change and improve dramatically as people are in lockdown. We all need to have access to healthy food, healthy air, healthy water. And then quality of healthcare. What a challenge that is to all of us. I mean, really, the clinical resources are certainly there, but we're learning dramatically how much our social and behavioral health issues are really going to challenge the quality of the healthcare we get and how we're able to consume that. As I said before, health equity has been bubbling up for years. We've known that people who are financially disadvantaged, people who are of racial and ethnic, certain racial and ethnic backgrounds are really challenged. But it's kind of bubbled under the surface. And I think when we watch daily issues of Black and brown individuals getting COVID much more frequently, being hospitalized, and in fact dying at a much higher rate, we can't ignore this situation anymore. For many years, we've been talking about the impact of social determinants of health on healthcare. And there's been lots of discussion, there's been lots of investments, but I think it's only been really in the last 12, maybe even 18 months that the healthcare industry has said, this is not just something that we should do. This is something that's really a requirement of the industry. So let's talk about the perfect storms. I'm from New England, and in, I think it was 1997, two hurricanes came together off the Massachusetts coast, creating what was called the perfect storm. The Gloucester fishing fleet happened to be out at that time and lost many ships. And so we're talking today about really the collision between the economic downturn and challenge and the pandemic. And the next, I think, perfect storm is going to be all of the unmet health needs, particularly around mental health. So I think the issues of health equity, the issues of increased demand are really going to force us to take a real hard look about how do we really address this issue? How do we really put an individual's health in the context of their environment? So how do we remove the barriers to health equity, and why do we really care? I think there are a couple of issues at stake. One is about improving. It's about improving community health. It's about health literacy. From what I read and hear and understand, a lot of the hesitancy about vaccination is health literacy issues. People don't really understand, or they've heard, the rumors about, the awful side effects that the vaccines have and don't really fully understand the benefits. A lot of chronic diseases are in fact blamed on the lack of health literacy. What is healthy food? What is the right nutrition? What are the right exercises? And citizen engagement, I mentioned it earlier. I mean, I think it's really important to think about the fact that downtrodden individuals do not feel empowered. They do not feel engaged. And I think it's really critical to raise that bar across all aspects of an individual. And service adequacy. I mean, in the suburbs, we have a CVS every 4.5 miles. I don't think that's true in other geographies, particularly in inner cities and or in rural areas. And so part of the challenge that we really face is around identification. Who are people who are at risk? We used to think it was just people who were older, people who had multiple comorbidities, and we now know that it's people that don't have enough food. It's people that don't have access to transportation. And we need to understand the context of that health. I think one of the real aspects of geospatial data is it helps create that context. There are gaps in resources. Many communities do not have access to healthy, nutritional, fresh foods. And we know that that is really a critical issue, particularly with folks who are diabetic, for example. And so how do we bring that food source in and begin to really understand that that is the appropriate lever for treating diabetes, for example? Some of the really interesting work that's being done using geospatial data in combination with clinical data is understanding the impact that these social and behavioral and health and human services have on health. I could have a laundry list of social and human service needs, but if it's not going to impact my health, then maybe that's not the best investment to make. And one of the soapboxes that I like to get on periodically is about metrics. We have been funding social and human service programs, community-based organizations for centuries, probably not centuries, but for quite some time. But we've never really had the metrics to understand the benefits of those programs. We may measure the number of outreaches that are done. We may measure the number of people who we spoke to, but did it really make a difference? And that's when I think bringing together the geospatial data with the clinical data really helps us to understand what are the right levers to pull so we actually can get to health equity. So let's talk about the challenges and opportunities. One of the challenges that I think is becoming even clearer is the lack of infrastructure. Public health in the last 10 years has lost almost 20% of its funding. I heard an estimate the other day that to be properly staffed public health across this country really needs to have about is missing about 240,000 individuals. So that's the understaffing level. We're beginning to see in the US, through the recent legislation, the American Recovery Act, money being put into public health infrastructure. There's a Senate Bill 509 that's just been submitted that gives HHS $150 million. So not a lot of money, but some money to begin to build private and public infrastructure and partnerships at the state level and at the community level. And I think that's one of the real challenges is organizations haven't worked together. They're all in silos. The data is really complex. I grew up and spent a good deal of my career working with healthcare payer and clinical data, financial and clinical data. And then I started doing the research on the geospatial side, and the number of data, the amount of data is really significant. And so how do you decide what's the right data to bring in and to look at when you're applying and trying to research and identify problems? I talked a bit earlier about kind of the lack of analytic rigor. We know that the right thing to do is to provide maternal and child healthcare services. We probably have been able to measure some of that by reduced infant mortality, but still the lack of analytic rigor, lack of setting up KPIs of ROI models. And again, it comes back to the notion I was talking about earlier. What are the right levers for us to pull to make sure, in fact, what we are providing in the way of services, what we're identifying is really going to improve the health and provide that health equity? Lack of payment policy. Right now, there's a lot of discussion about payers and providers reimbursing community health organizations for the services they provide, but there's no mechanism to do it. We're beginning to see some technology being developed that will, in fact, support that. Then look at opportunities. You can create an ecosystem for change. We have worked in silos for so long and not really made any progress. we can improve the health equity of the population. I don't think it makes any of us feel good to know that our brothers and sisters in other geographies are not getting the same benefits that we are. There's some financial benefits. Get people out of the emergency room, also a quality perspective. People who are engaged are more compliant. People who are happier will be more compliant as well. So really we see a huge opportunity to create that health equity and to make improvements really at the grassroots and community level. So let's talk a little bit about the data. So geospatial information systems, in the simplest of terms, really bring together two sets of data. One is about community needs. What's the air quality like? What's the weather like? What kind of housing is available or not? What kind of transportation? And it brings that together with community resources so that we understand, again, about public transportation, about food sources, about community centers. And so I think one of the roles of geospatial systems is to bring together and identify those community needs with the community resources to help us plan. And the reason I put the individual's data off to the side is that the data does not always have to be pulled together in terms of patient data or individual data and community or geospatial data. And I think the geospatial data really sets context. It really reminds us that individuals do not stand alone. They're not in isolation. Their life experience is really set by the context of their life. We are beginning to see organizations bring together those two data sets and really get a better understanding, again, of context. What is it that a community needs? What is it that individuals in that community need? As well as what are the resources we have to provide them and really bridging that gap. So I think it's important to differentiate between data and intelligence. You know, as I said earlier, geospatial data, which is data about location and attributes and timing. It's a huge amount of data points, you know, probably thousands, tens of thousands of data points. And how do we turn that into intelligence so that I know that the needs of a community are the same as the resources, or there's a gap in those resources that I need to then fill. And so the intelligence is connecting those data dots, if you will. So you can identify the equity issues. You can create the resources or call on the resources that are needed to improve health outcomes. And it also helps you identify and then measure and understand performance. If there's one message that I share with you and ask you to take home, it's about the metrics. It's about being able to establish benchmarks, reach those benchmarks, because that, frankly, I think is how we're going to get sustainability. I think a lot about sustainability of programs. And so I just put together this real simple wheel, which sort of says, first you identify the problem, clearly a data issue, an intelligence issue. You do the analytics and analysis on that data to really make sure that you're understanding your population and that you've pulled the right data. You design the program, and then you establish the metrics. I was talking to someone a couple of days ago about a program in the Washington, D.C. area, where I think it was a healthcare payer had identified that there were diabetics in a certain geography that were using the emergency room more often, were having their A1Cs much higher than they wanted to. They worked with a community-based organization to create a nutrition program so that those individuals were given a $20 a week voucher for food at a local food store that had a lot of nutritious fruits and vegetables. And over time, what they realized was individuals were not going to the emergency room. Their A1Cs were being lowered, although it was too early to be definitive on that. The food store was delighted because they had more business. And in fact, were able to be more generous in their contribution towards the program. But they had established specific metrics of what they wanted to accomplish. They wanted to keep people out of the emergency room and ultimately improve their A1Cs. In this case, they didn't need to adjust the program, but there certainly are circumstances that all of us can think about where our first shot out of the gate wasn't the most accurate. And so I think we want to continually take a look at and evaluate the programs that we're designing and developing. So I want to leave you with a little bit of essential guidance. It's really critical to take advantage of geospatial information systems and the data that they bring together. They're really critical to exposing community needs and the barriers to health equity. The volume and complexity of geospatial data really requires special assessment. One of the things that I've learned in my research over the last couple of months around social determinants of health data and geospatial data is it's not a one-size-fits-all. You can't just load a bunch of data in and think you're going to solve a bunch of problems. You need to be very specific about what data you bring in to solve what problem. And really importantly, that the sustainability of programs requires analytic rigor. You need to establish key performance indicators. You need to monitor progress and make program adjustments. And with that, I wish you all the best of luck. Thank you for joining us today. I really appreciate it. And my email is on the last slide. And I encourage you to reach out to me if you have questions or want to have a chat about what we discussed today. So thanks again for your participation.